We talk about hiatal hernia syndrome, and if you've ever suffered with it, your stomach's on the left, but you can get pain actually across your entire abdomen due to the pressure and the bloat. And I've noticed that a lot of patients who I've spoken to, these are new patients who we have not started working with yet, but they've had their gallbladder removed. And because they were told, oh, that's the source of your pain and discomfort, only to have their gallbladder removed and absolutely nothing change with how they feel. So while we can certainly survive the elimination of a gallbladder, it's not ideal. It's an extremely common surgery. 500,000 Americans have this surgery every single year, and it's due to having stones, having sludge. So sludge is basically kind of broken down stones. If, compare it to sand on the beach versus a rock on the beach. But what concerns me is that we have some gallbladder malfunction, or maybe not, but that's what we're going to talk about. So you have this discomfort. Now, you can have a gallbladder attack, which is very, very painful. People liken it to having a baby. So if you're a female and you've done that, you know what that's like, as do I. And so it's extremely painful, but you can pass a stone, and what's exciting is you can reverse gallbladder disease. Now, what's problematic is if the stone is large and it's stuck in the duct of the gallbladder, then we have a problem, and then surgery is warranted. But very often I have patients tell me that when they looked at the report after their surgery, especially, this is prompted by the fact they didn't feel any better afterwards, is that there was some sludge, but the gallbladder was functioning, or there were some stones, but they were small and nothing was stuck in the duct. And so what's important to realize, so I'm really speaking to people who have this discomfort. Maybe you've had a gallbladder attack, your doctor is pushing you to have surgery, but the facts are that the gallbladder can be repaired and rehabilitated, and you don't need to lose it. So let's talk a little bit about what the gallbladder does. It breaks down fat. So the gallbladder is kind of the junior to the liver. So the liver makes bile, and then the gallbladder stores the bile so that every time you eat a meal containing fat, the gallbladder just kind of squirts out some bile into your upper small intestine. So we have the stomach, and then the stomach, when it's done churning around the food and breaking it down to a degree, it's got enzymes doing that, then the contents of your stomach enters your upper small intestine. It's called the duodenum. Now, when that stomach acid food combination enters your upper small intestine, so does bile enter the upper small intestine. So you've got the acidic contents of the stomach, and then bile is very alkaline. So bile is acting as a detergent to make the contents coming from the stomach less acidic, and also to break down the fat so you can absorb nutrients. But also it acts as a bit of a detergent to kind of keep that upper small intestine nice and clean of inhospitable organisms, etc. So when your bile is too thick, then it can't be secreted as efficiently, and you tend to have less efficient digestion, but you get more of a toxic environment. So bile that is too acidic will cause toxins to multiply in your small intestine. You've heard of SIBO, small intestinal bacterial overgrowth. That can happen as a result of this. And also, if it's too acidic, it actually damages the lining of your intestine, because that's not the pH that's supposed to be moving through that part of your body. So while the stomach is a bag of acid, happily, your small intestine is not supposed to be that acidic. And so bile that is malfunctioning results in too acidic of an environment. It allows toxins to grow, and it also leads to autoimmune disease. So this is an interesting connection, because low thyroid, I know it might seem like I'm all over the place, but hang in there. So when you have a low thyroid, what happens is your ability, the liver's ability to break down cholesterol is diminished. So I always tell patients how all our parts of our body are connected, and it's fascinating how interconnected every part is. But low thyroid doesn't allow the liver to metabolize or break down cholesterol, and bile is mostly cholesterol. So when you can't do that, it results in a thickened form of bile. So I'm just going to check my notes to make sure I'm not forgetting anything. Yes. So yes, all those things. Good. So what should we do? Now, if you've already lost your gallbladder, there's things you can do to kind of assist your liver to enhance your digestion and absorption. But if you're somebody sitting there, maybe you've had a gallbladder attack, they've told you there's sludge in your gallbladder or there's small stones, too soon to get rid of that gallbladder, because there's a lot you can do. Now, I just done a video recently about fatty liver, so you can definitely look at that. But much like fatty liver, gallbladder disease is driven by insulin resistance. So how do we get insulin resistance? That's hearkening back to the standard American diet, which is unhealthy, of course. Why? High in sugar, high in processed foods of all types, but especially the highly refined carbohydrates, high in fructose, maybe too much alcohol, and even the processed meats were mentioned in the research that I was doing as far as being troublesome for the gallbladder. What's missing in the diet is green leafy vegetables and enough water, interestingly enough. I mean, we always talk about important to hydrate, but 95% of bile is water. So people who are chronically dehydrated will get thickened bile, and that thickened bile can't be secreted, and leading to all these problems that we talked about. So I'm just going to check down here again. Oh, and fiber. So I knew there was one more thing. So having fresh fruits and vegetables, nuts and seeds, these foods are very high in fiber, and that helps gallbladder function as well. So nothing unusual about the dietary recommendations, but this association with losing one's gallbladder prematurely, I think is something that's really important to talk about. So getting back to hiatal hernia syndrome, what happens with the pressure, this increased pressure that comes from an inflamed bowel, as we mentioned, when the bile is too acidic, and a diet where you have a lot of bloat, maybe constipation, all of that is increasing that intra-abdominal pressure. The stomach gets pushed up, the diaphragm gets pushed up, they're both impinging on where the heart should be, and then you have the cascade of acid reflux, shortness of breath, heart palpitations, panic attacks, these things that all sort of domino after this imbalance of digestion and gut. So the gallbladder is not something we've talked about a lot as associated with hiatal hernia syndrome, but it's an integral part, and it's also a part of our body that is, I think, too often left on the surgeon's floor, as the expression goes, because it's a surgery. By the way, it's the most common procedure worldwide. I didn't know that. So it's extremely common, but thoughts are too premature, because you can have had a gallbladder attack, you can handle the sludge, the body will repair, just like the fatty liver will repair, just like so many things in the human body can repair. So don't think it's too late for your gallbladder. There's a lot you can do, and if you need assistance, we're here for you, myself and my team. So reach out for a consultation, and we'll figure out how we can get that gallbladder and liver functioning better. And if that's part of hiatal hernia syndrome for you, then we'll address all of that.